Hello, I'm Janie Nichols, Infection Prevention Specialist.
And I'm James Toe with Safety and Prevention.
Personal protective equipment, or PPE, is required to protect paramedics and patients from exposure to infectious organisms and blood or body fluids. PPE is used to prevent exposures by placing a barrier between the infectious source and clothing, skin, mucous membranes, and airways. The selection of PPE is based on the risk assessment dependent on the nature of the interaction with the patient and the likely modes of transmission of the infectious organism.
Contamination can occur due to failure to use PPE, PPE malfunction, incorrect use of PPE, and self-contamination during care and in the doffing process.
So, why do we have to clean our hands before we wear gloves? The short answer is we need to clean our hands before wearing gloves because the gloves used for routine patient care are not put on in a sterile manner. Think about it. Paramedics reach in and grab gloves from the box and then hurry to put them on. During this process, you touch the gloves with your hands to put them on. If your hands aren't clean, any organisms on them will be transferred to the outside of the gloves. Long-sleeve gowns should be used to prevent uniform or body contamination. The gown does not need to be sterile, but it should be fluid resistant. The gown should always be tied at the back. If the provided gown does not fit, wear one gown as you would a coat, tie it at the front, and then wear a second gown as you would normally.
Wearing a fit-tested N95. Each N95 respirator is fit-tested annually for each individual, as N95s are not a universal fit for all face shapes and sizes. Always perform a seal check when first putting on the mask. Seal checks are done by covering the mask with your hands and gently inhaling and exhaling. When inhaling, the mask should collapse slightly. As you exhale, there should not be a feeling of leaks or air escaping. Readjust the positioning of the mask or nose strap until you are able to get a good seal. Users should be clean-shaven at the seal points of where an N95 comes into contact with the user's face. This aids in keeping a seal to the user's face to prevent any particulates from entering the mask and the user's breathing zone. The back strap should be touching skin on the back of your neck without interference from strands of hair. Putting on a full face shield. The face shield is to prevent any droplets, for example viruses, from entering the eye mucosa. It offers protection from exposures to infectious droplets or blood and body fluids via splash or spray. Eye protection should be worn when within 2 meters of a coughing or sneezing patient. It is also indicated for care activities and procedures that may generate sprays or splashes of blood and body fluids. N95 respirators are not fluid resistant, and a full face shield should be worn if sprays or splashes are anticipated per your risk assessment.
Now we're going to wear gloves. It is important to ensure that you fit the gloves over the cuff of the gown.